Diabetes and the need for good nutrition. When our bodies digest food, there are many hormones and chemicals that the body must deal with. Everything we eat converts to blood glucose, and one of three things happens: it is burned right away, converted to glycogen and stored in the muscles for later use, and converted to fat to be stored for longer periods of time. One of the most important factors in the digestive process is how much insulin is released, because insulin is what decides which nutrients to burn, and which to store in the body. In those who have higher blood sugar levels in their bodies, more insulin is released, and more food is stored as fat. But, in diabetics, there is not enough insulin released by the pancreas, which makes dealing with blood sugar quite difficult for the body. Types of diabetes. There are 3 types of diabetes, 2 being permanent conditions, the third often being a temporary condition. Type I of juvenile diabetes is usually discovered during childhood, and about 10% of all diabetics are type 1. Source: AMA, 2005. Type 2 diabetes was once thought to be a condition only found in adults, but these days, more and more children are being diagnosed as type 2 diabetics. This is a condition that is often associated with obesity, and about 90% of all type 2 diabetics are obese. The last type of diabetes is gestational diabetes, which occurs during pregnancy, and usually goes away once the baby has been born, although sometimes it does remain. This is considered to be a lot more serious than other pregnancy symptoms, because it may be that it is a factor of a condition that the woman already had in the first place. There are many other conditions and diseases that can develop as a result of diabetes, and it can also make any existing conditions or diseases much more serious. Those who have diabetes are at a higher risk of developing heart disease or having a stroke, and it is a huge factor of kidney disease. Diabetes can also lead to vision problems, and eventually, blindness. Because of the risk factors involved with diabetes, it is incredibly important that anyone who has any warning signs whatsoever be tested as soon as possible. Approximately 14 million Americans are diabetics, and this disease is the third leading cause of death in the U.S. Testing for diabetes. Testing for diabetes can be done in a couple of ways. Of course, it can be found with a simple blood test. But, there is another test that can be done to find out if a person has diabetes. This test, the A1C test, is recommended by the American Diabetes Association, and it measures how blood sugars have been controlled during the 3 months prior to the test, and it can tell if a person is at risk for developing diabetes, which is also known as a pre-diabetic condition. It will also tell if a person is in fact diabetic. The average adult should begin getting tested for diabetes at the age of 45, but, if there are any risk factors involved, such as hypertension, high cholesterol, obesity, or family history, testing should begin at an earlier age. Other risk factors that make it necessary to be tested sooner are being a member of certain ethnic groups: Hispanic Americans, African Americans, Native Americans, Asian Americans, and women who have had gestational diabetes, or delivered a baby weighing over 9 pounds. Warning signs of diabetes. There are a number of warning signs to look out for that may suggest you have diabetes, or are pre-diabetic. Some of the warning signs to be aware of include constant hunger, increased thirst, blurry vision, unusual tiredness, sores that won't heal, frequent urination, especially at night, weight loss that cannot be explained, irregular menstrual cycles, chronic yeast infections. Proper nutrition for diabetics. It is important that everyone follow a healthy, well-balanced diet, but, for those who are diabetic, or are at risk of developing the disease, a good diet is even more essential. Diabetics are at risk of becoming obese, and obese persons risk developing diabetes, so it is necessary to make sure that the diet is one that will help to lower body fat. Often, those who have diabetes are able to control their condition through a healthy diet, but, there are others who need to take certain medications, and may even need to have regular insulin injections. There are also patients who have insulin pumps that are inserted into their abdomens, which release insulin as needed. Now, back to diet. Even a small loss of weight can affect how much medication will be needed, which is a wonderful incentive to lose weight. The American Heart Association advises using the DASH diet, dietary approaches to stop hypertension, which includes many fruits and vegetables, as well as whole grains and low-fat dairy products. Sodium, red meats and sugars are limited on this diet. There are 3 macronutrients that we all need for survival: proteins, carbohydrates, and fats, and they must be included in our diets each and every day, no matter what our health conditions are. But, it is even more important for diabetics to make sure that they are getting the proper nutrients in their diets. Diabetics, and those with kidney or heart disease, should not have too much protein in their diets. According to the American Heart Association, the optimal amount of protein to have in one's diet is 35% of the daily caloric intake. As well, the diet should include 50% carbohydrates, and 15% fats. Source: The American Journal of Clinical Nutrition. Protein and a diabetic diet. It is essential that there be protein in everyone's diet, and diabetics are no different. Protein plays an important role in many functions of a body, and with a reduced calorie diet, it may be necessary to add protein supplements to make sure that diabetics are getting the protein and other nutrients they need. But, it is also important that when using protein supplements that diabetics choose the right ones. One of the best things to do is to consult a physician, to find out if protein supplements will help, and which ones are best for each patient. One protein that is very popular is ProfectR by Protica, which is made from whey, a complete protein. Not only is ProfectR a great source of protein, with 25 grams in each 3-ounce serving, it is also great for low-calorie diets, because it only has 100 calories per serving. It is a great snack for between meals, and when consumed before eating, it helps to stabilize blood glucose levels. ProfectR has 0 carbohydrates and fats, but provides 100% vitamin C and 10% of the B-complex vitamins. And, it comes in many delicious flavors, including grapefruit mango, blue raspberry, fresh citrus berry, and cool melon splash.